Western Sydney's healthcare system is at a critical crossroads, and the NSW Premier has openly admitted that the current state of hospitals in the region simply isn't cutting it. But here's where it gets controversial. While promising significant improvements, Premier Chris Minns has once again rejected calls from the opposition for a formal inquiry into the hospital's ongoing struggles, insisting that the public wants the government to focus on action rather than investigations. During the unveiling of new artist renderings for the ambitious $2 billion Bankstown Hospital project set to be completed by 2031, Minns acknowledged the shortcomings of existing health services in Western Sydney. This hospital, which was initially announced by the Berejiklian government back in 2019, but only had its site finalized this year, is now receiving renewed attention and funding. The Minns administration has pledged an additional $700 million in the recent June budget, alongside $100 million allocated to relocate the TAFE currently occupying the site, clearing the way for construction. The Premier described this hospital as the largest single public works investment in the state's health sector, emphasizing the urgent need to catch up with the region's rapidly growing population. We know that health services in Western Sydney have not kept pace with population. Construction is slated to begin next year, and the facility promises significant expansions, including a larger emergency department, more operating theaters, additional clinical spaces, a dedicated mental health unit, and enhanced maternity and birthing services designed to better support mothers and babies. Yet, despite these plans, the current system remains under immense pressure. Recent data from the Bureau of Health Information paints a stark picture of the challenges faced by Western Sydney hospitals between April and June. At Bankstown Hospital, patients spent a median of 5 hours and 22 minutes in the emergency department, with 1 in 10 enduring waits longer than 19 hours. Westmead Hospital's figures were even more concerning, with a median emergency department stay of 6 hours and 12 minutes, and 1 in 10 patients waiting over 20 hours. Bankstown Lidcombe Hospital fared somewhat better, with a median emergency department time of 3 hours and 43 minutes. However, only just over half of the patients began their treatment within the recommended time frame. Dr. Nicole Delatte, an emergency physician at Bankstown Lidcombe, described the hospital as often feeling packed to the rafters, especially during the winter months when demand spikes. "We've poured our heart and soul into our work this winter, but it's been overwhelming and incredibly busy at times," she said. This new facility represents a chance to work in a much larger and better environment. The government has also reported some progress in reducing ramping, a frustrating practice where paramedics are forced to wait with patients before they can hand them over to emergency department staff. At Bankstown Lidcombe, 86% of patients were transferred from paramedics to ED staff within 30 minutes, marking a 10 percentage point improvement compared to the same period last year. Still, Premier Minns admitted that while improvements are happening, they are slow going, but insisted the government is turning the dial. However, the opposition remains unconvinced. They argue that the government's announcement about the new Bankstown Hospital is little more than pretty pictures, without addressing the urgent ongoing problems. Opposition leader Mark Speakman criticized the Premier for not launching an inquiry into Western Sydney hospitals, which he described as delivering horror story after horror story. Minns countered by saying that a special commission of inquiry into hospital funding had already taken place, and that the public prefers the government to focus on delivering resources directly to frontline services rather than conducting more investigations. "My sense is the public wants us to get on with it, and they want whatever funds and resources can be deployed put straight onto the front lines," he said. But Speakman fired back, pointing out that the previous inquiry did not specifically focus on Western Sydney hospitals. What does Chris Minns have to hide when it comes to Western Sydney hospitals? He asked, hinting at possible undisclosed issues. Shadow Health Minister Kelly Sloan also weighed in, highlighting disturbing reports of patients sleeping on floors and other horror stories that she believes warrant a thorough investigation. The Premier is making excuses and sidestepping the real issues, Sloan said. The people of Western Sydney deserve so much better than this. This ongoing debate raises important questions. Is the government's focus on building new infrastructure enough to solve the deep-rooted problems in Western Sydney's healthcare system? Or is a more transparent and detailed inquiry necessary to uncover and address the underlying issues? What do you think? Should the government prioritize immediate action, or is it time to dig deeper into what's really going wrong? Share your thoughts below and join the conversation.